thank you for the Expo for having us here today. It's wonderful that we can get out this information. My problem is 20 minutes is a very short time to get all this information to you. So if I can get one thing across to everybody today is that be aware. Sometime along your journey through pregnancy and even afterwards, you may not get all the information about safe sleeping, and you need it. Also, as a new parent, you are faced with difficulties such as a baby that's not sleeping. And then your mother or mother-in-law says to you, when you were young, I used to sleep you on the tummy and you slept much better. What are you going to say or do? Or you might go to mother's group and a mother says, oh my goodness, my baby was unsettled and I used a pillow and I did this, I turned them onto the side and they were fine in the morning. What are you going to say and what are you going to do in your practice? So today I'm going to go through briefly, but please ask us questions because you need to know and you need to understand why we say the messages that we do. If you don't understand the importance of them, you won't do it and you may change that practice and therefore your babe may be slept unsafely. How long does a baby sleep for in that first year of life in a 24-hour period? What's the average, do you think? It's around about 18 hours a day when they're young, newborn, and it goes less as their sleeps, their wake time becomes more, their sleeps less. So the average for that first year of life is 14.5 hours a day. That's over half a 24-hour period. So if you had a little one and you were driving in a car for 14.5 hours a day, would you ever think of not putting them in the right capsule, putting them in the right car seat, putting them in the right seatbelt? No. Same here. Our little ones are in a sleeping environment for so long, we need to know what is the safest place to sleep them, especially because when they're asleep, we're not going to be there half the time supervising them. So let's go through 6 simple messages. How to sleep our babies safely to reduce the risk of SIDS and sleeping accidents. It's easy. Sleep baby on the back, but why? Keep head and face uncovered, but why? Keep baby smoke-free during pregnancy and afterwards, but why? Sleep the baby in a safe sleeping environment, both in the daytime and nighttime. That includes when you're going to somebody else's house. That includes when you're going on holidays. What products are you using? What's in that product? What bedding? Sleep baby in a safe cot in the parent's room. That seems to be because the evidence is showing that babe's more aware of where you are. They can hear you snoring at night, so it keeps their arousal up. On the other side, you're more aware of what's happening to them in that cot. And breastfeed babe. Let's go through the whys though. Why is it so important that we sleep baby on the back? Especially I see here today dads and grandparents. And grandparents back then, how did you sleep your babe? Backside or tummy? Tummy? Yeah, tummy. So why are we changing? Your babes are okay. Why was this baby okay on the tummy, but this one was not? Why was this little one okay in a smoking household, but this one wasn't? Why is this little one okay underneath blankets with their face and head covered, but this one was not? This is a very simple thing to show. The little one in the middle, sadly, is the little one that we know, and the numbers were high in the 80s, up to the 80s. We've been able to, by getting our information out, reduce the number of little ones dying by over 80%. That's huge. Best result of a public health campaign ever. So the little one in the middle, they say for this little one to die from SIDS, it has to have 3 circles around it, 3 big factors, and it's like the spokes of the wheel coming together. The first circle, what's that one? It's the infant. The infant is under 12 months of age, peak age 3 to 6 months, definitely under 6 months. One that's low birth weight, born prem, maybe one of a multiple. That's the picture of the infant. Also, a lot of them may have a little bit of a cold or infection at the time. Over all the years, out of all the research, we've been able to see that there are certain risk factors in our sleeping environment that increase the risk of SIDS or sleeping accidents. What are they? Tummy sleeping and side sleeping increases the risk by over 9 times. Head covering. That's because of the overheating. The covers can cover their little face and airways, or carbon dioxide rebreathing. The smoking issue. Both in pregnancy, where if we're smoking, we're more likely to have a low birth weight, and also afterwards, their arousal goes down if they're smoking around. They become more vulnerable to infection. Harder to breathe. You know what it's like if you go out for a night in a smoking environment. The carbon dioxide rebreathing and the unsafe sleeping environment, such as soft, puffy bits and pieces in there. So why is that little one more vulnerable in that environment to that one? This is where the research is going in the third circle. We actually don't know. We believe, it's something to do with the brain. There's something in that little one, the makeup, that they look normal, they look healthy, they are healthy, but something switches off when the environment is not safe. To prevent these little ones from dying from SIDS or fatal sleeping accidents, we need to take off one of these spokes of the wheel. Can we do anything about the infant? No. Can we do anything about that brain factor? No. The only one we can work with, and it's so important that we do this, is our infant care practices. So, let's go through those 6 things. It is important to sleep babies on the back, not on the side or tummy. The tummy, we know, increases the risk of SIDS. Arousal's down, blood pressure can decrease, their cerebral oxygen rate down. It's difficult for them in some little ones. We know back then a lot of babies were okay on the tummy, but we don't know which ones. The side position too is dangerous, also more dangerous because starting off on their side, they're more likely to plop onto their tummy into that position. I'll go through quickly because I do have grandparents. What are you all most worried about with babies sleeping on the back? Choking. My baby will choke on the back. I'm going to show you so you can show your grandparents and those caring for your babes that that will not happen. So, 3 positions baby can sleep on, backside or tummy. Pretend I'm your baby. I'm on my back to start off with. All food air go through my mouth, down one tube to here, divides into 2. If I do those 2 tubes, it looks like that. The air going down this one and the food going down this one. At the base here, we have protective pits. With gravity, where does fluid fall? Up or down? Lowest area? So there's our saliva, there's our snot, there's our reflux. Sits down there until we swallow. If I was going to choke, what does that mean? Goes down the wrong way and I start to cough? Look how far it has to go down the wrong way. Now turn me over on my tummy. The tubes are now reversed. This one becomes the one taking the air, this one the one taking the food. Where are those protective reservoirs? Up the top. Where is fluid gathering with gravity? Down the bottom. We know babies sleep better on the tummy, absolutely. If they sleep better though, they're going to be in a deeper sleep. If you're in a deeper sleep, what happens to your conscious level? What happens to your breathing rate? What happens to your swallowing rate? Everything slows down. So that fluid remains around there for longer, it builds up, and look how far it has to go down the wrong way. In which position are we safer in? Now let's go to the side. Now those 2 tubes are that way. The air, the food, protective, fluid there with gravity. Can you see? There's still a risk of aspiration. So normal healthy babies are much safer on their back as well. Make sure you tell your carers that. Okay, let's go through because I've only got 10 minutes. Keep your baby's head and face uncovered. This is very important. They regulate their temperature through this way. We don't want soft, puffy bedding going over their airways. 2 ways we can do that is by using blankets, or if you do not want to use blankets, you could use a safe baby sleeping bag. Sleep baby with their feet to the bottom so they can't burrow underneath. Tuck the blankets in tightly so they can't lift them over their face or head because they can't in their development get it off. Or use a safe baby sleeping bag. There's many out there. A safe baby sleeping bag, because there's no standards for them, is one that doesn't have a hood. And I'll say there too, never place a baby, even for day sleeps, down in clothing that have hoods. Why? Because when they start to roll, which we want them to, but we want them to when they're ready and in a safe sleeping environment, it can get wound around their neck or stuck on something. So hoodie's off. So no hood, firm around here or here so they cannot disappear into that sleeping bag. Oops, sorry about that one. So this cot, don't have the pillows. Why? 2 reasons. Anything that makes a little one tilt forward like that, putting a pillow under their head, the head is much larger at the back as the little one, and they're more vulnerable. Everybody try to put your chin on your chest and see if you can breathe out your nose. It's difficult, but that's the position we're placing babies in when we put them in that curved position, whether it be on a pillow, whether it be on a beanbag, whether it be in a sling. We need to be careful. When they're asleep, they should be nice and flat so they can breathe well. No bumpers to roll into. No soft puffy surface that they can roll onto and be face down where it moulds around their face. And I do need to speed up, I know. Whoops, gosh. See what happens with that little baby on the pillow? In that curved position? Have them flat. Beanbags the same. On the couch, Dad, don't fall asleep with your babes. See that curved position coming up? And also, after that meal at night, hard day at work, that little one can slip and become stuck in that position and you're not aware where they are. Do not leave them unsupervised or asleep in any product where they'll tilt forward. Smoke-free in pregnancy and afterwards. We know that's a good thing for our babies. It's healthy. And the breastfeed. Quickly, safest place in their own safe environment, safe product next to the parent's bed. The room sharing. Here you are going to see many, many products. You need to think of the environment where you're placing your babe. What are you placing into that environment? Where is that product going to be? Can they roll and reach out and grab the wire of the lamp? Can they reach up the first time they stand and grab that mobile? Curtain cord. Make sure the area is clear. And if I get a chance, I'll talk about room temperature. Safe cot. Out of all the products out there, there's only 3 that have an Australian-New Zealand mandatory standard for sleeping a baby in. And up here too, I have brochures from the ACCC, so you can go to their stand and look at the products that we know are safe and there is a standard specified for that product. Those 3 products are the household cot. If you are thinking of using a second-hand cot, just be aware some of them may not be safe. As a nice cut-off point, there were major changes in the standard in 2005. So before that, lead paint might have been used. Before that, the 4 corners were higher. So if a grandmother is taking out from the garage a cot used many years ago, it may not be safe. The second product is the porta cots in late 2009. And that's a great one to use for travelling, to going somebody else's house. And the third one is the pram. However, the standard for the pram says never to use it unsupervised, nor as a permanent place to sleep your babe. Always where you can see and feel them. The mattress, firm, well-fitting, clean and flat. Clean, if you're using a second-hand cot, perhaps get a mattress for your own family. Clean if it's in childcare to wipe over. 5 minutes to go, I've been told. Round the edges, make sure it's well-fitting. No more than that you can fit, because we don't want babies when they start to roll to get stuck between the mattress and the side. Firm. How firm is firm? Use your eyes. There is a voluntary standard for firmness now, but use your eyes and use your hands. If it looks soft and puffy like a pillow, like a sheepskin, like a doona, then you know when your baby rolls over, they could become face down and it moulds around their face. Use your hand. Put your hand down on a surface. If there's a mark where your hand is, it is not firm enough. I will say with portable cots, if you're using a portable cot, it comes with a very thin mattress. Only use the mattress that comes with the portable cot. A lot of people think it's too hard and put soft and puffy on top or underneath. What occurs is when that little one starts to roll onto soft puffy, we have an issue with suffocation. Do not buy any mattresses to put on top, because what happens, you've got the porta cot with the very thin mattress. If you put an extra mattress in, when they start to roll, they push that elasticated side and now it's not well fitting. There's a gap where they can roll and get wedged. Safe bedding. No bumpers, no pillows, as we said before. Nothing that they can roll into. Oh, it keeps going. Couches. Do not place them on a couch on their own. They can roll off, they can roll into those pillows. It is not a safe alternative to a cot or a portable cot. Mum, not the safest, even if your mum's unsettled, your baby's unsettled or sick, to place them on the couch with you. It's too narrow and you're not quite sure what you're going to do. It's not a safe place to sleep. Or alone on the bed. So, some simple messages, and we need to talk. If you're thinking about sharing a sleep service with your babe, ring us, call us. We have a 24-hour number, we have a stand. But you need to know the reasons why and how to make a safe sleeping environment. The last thing I will say, has anybody got a toddler that they're going to be moving out of the cot into a bed because a newborn's coming? If so, we have a new resource called the Cot to Bed. It's a very important resource because our next injury time is when that little one is starting to climb and will fall out of the cot, or parents have moved them too soon out of the confines of the cot and they're not ready for an open environment. So please come and get this brochure. It's a very important one for you all to see and visit. Otherwise, visit our website or come over to our stand. Are there any questions quickly?